Hello, and welcome to Group 4's project report upon pyruvate dehydrogenase deficiency. My name is Anthony Chella, and I'll be presenting along with my partner, Santiago Romero, who will present shortly. Without further delay, I must explain what exactly pyruvate dehydrogenase deficiency is. This genetic disorder, as you can see, is characterized by an unnatural buildup of lactic acid in the body. This disorder is thankfully rare, but can often be lethal. The deficiency itself is characterized by a number of unpleasant symptoms, such as nausea, vomiting, and severe breathing problems, as well as irregular heartbeat, to name a few. Most notably, there can also be neurological problems associated with this disorder, including delayed development of motor skills, seizures, poor coordination, and notably intellectual disabilities, as well as learning disabilities. Long-term complications of this disorder include said neurological problems and can possibly lead to death, especially in males. Most affected do not survive past childhood. Now, the causal analysis can be traced back to the pyruvate dehydrogenase complex, which is the entry point of pyruvate into the citric acid cycle, all of which you learned about in week 8. The complex itself is made up of multiple enzymes, such as E1, E2, and E3 to name a few. The cause itself is often in one or more of the alpha subunits of the E1 enzyme. When the instructions for any of these alpha subunits are corrupt, then that can lead to a malfunction of one of the alpha subunits of the E1 enzyme or more. When these alpha subunits malfunction, it leads to the E1 enzyme malfunctioning. And if the E1 enzyme malfunctions, it will lead to the pyruvate dehydrogenase complex. And as a result of the complex itself malfunctioning, pyruvate then cannot enter into this citric acid cycle and oxidize into acetyl-CoA, as it is supposed to. Due to this immense error, with aerobic respiration essentially crippled, the body then must turn to, you guessed it, anaerobic respiration. Since our body doesn't go through alcoholic fermentation itself, it must turn to the other means of anaerobic respiration to get ATP that it knows of: lactic acid respiration. And this will lead to, again you guessed it, an unusual buildup of lactic acid in the body, which will result in the symptoms I mentioned earlier. Here we can see a karyotype in which you can see the X gene that would be affected by this genetic disorder. We'll discuss more about this on the next slide. The instructions for this E1 enzyme are located in the PDHA1 gene, which is located on the X chromosome. As we have learned last week, X recessive inheritance patterns have special parameters for inheritance of the gene, or genes. For example, males cannot pass any said condition onto their sons, since the male can only give a Y chromosome to a male child. Also, the males, who have only one X chromosome, are likely to exhibit worse symptoms than their female counterparts, who might have normal X chromosomes to mask the mutated ones, although the mutated X chromosome causes a skewed X inactivation, leaving more normal X chromosomes deactivated than normal. And here we can see is the Punnett square for X-linked recessives. It is worth noting that this particular Punnett square is designed for hemophilia. This can lead to a mischaracterization of the disorder in question because, unlike hemophilia, pyruvate dehydrogenase deficiency does not require both X chromosomes to be affected in order for females to experience symptoms, as we mentioned earlier. Just one X chromosome that is mutated can lead to symptoms in females, although, as we discussed earlier, the normal X chromosomes might be able to mask it, or maybe even they might not experience any symptoms at all. Here you can also see a pedigree chart in which you can see the inheritance pattern of this disorder, characterized particularly by sons only getting the disorder from their mothers, and affected mothers passing on the condition to their daughters, as well as just carrier mothers passing on the carried gene to daughters who become carriers. And for the rest of the presentation, I shall turn the audio over to my partner, Santiago.
Thank you, Anthony. Now to move on to the risk factors that come along with pyruvate dehydrogenase deficiency. The risk factors that come along with pyruvate dehydrogenase deficiency include your gender. In terms of gender, if you are a male, you are at a much higher risk of obtaining pyruvate dehydrogenase deficiency, and this is a result of having only one X chromosome. Another risk factor for pyruvate dehydrogenase deficiency is family history. If someone in your family has a history of dehydrogenase deficiency, then there is an increased risk present for you inheriting the disorder. And as Anthony explained earlier, males cannot inherit the disorder from their fathers. Now, in terms of tests, the tests used to make the diagnosis for pyruvate dehydrogenase deficiency, this disease can be tested through blood tests, performing a brain MRI, a urine test, and genetic testing. For the blood test, what this does is they use this to measure the levels of lactic acid or pyruvate in your blood. In the brain MRI, they check to see for brain damage. And the brain damage that it could include are things such as an abnormal corpus callosum, an asymmetric ventricular dilation, ventricular septations, and small pons. If we are able to spot these signs, then there is increased chance that we can help diagnose this disease earlier. For the urine test, they look for your alanine and your amino acid levels. And in the genetic testing, they use this because it may be caused by mutations in the genes that are responsible for production of protein components of the pyruvate dehydrogenase deficiency. And it may be present with lactic acidosis. Now on to the next slide. For diagnosis, it is suspected in people who have lactic acidosis or signs of early onset neurological diseases. These diseases consist of seizures, lethargy, and poor feeding at a young age. It can be confirmed by testing the activity of the pyruvate dehydrogenase complex and the activity of all the specific enzymes within the complex. Now, in terms of treatments, there are several treatments that are available for the disorder. Some treatments include vitamin B1, thiamine, carnitine, or lipoic acid. Thiamine is a cofactor for pyruvate dehydrogenase, an essential enzyme for aerobic metabolism. In the absence of thiamine, the conversion of pyruvate to acetyl-CoA is inhibited, and as a result, it cannot enter the Krebs cycle. Another treatment is going on a ketogenic diet, and the ketogenic diet consists of going on a low-carb diet where you only consume low carbs, and the idea is for you to get more calories from proteins and fat, and consume less from carbohydrates. And the last treatment is oral citrate, which helps make your body organelles and fluids less acidic.
Now 13, the carb-free diet has done wonders for him.
He still struggles when he's congested with losing his speech for short periods of time, or we call it getting wobbly. But in looking at where he could be with this disease, he's doing very well.
However, the peripheral nerve damage Alex suffered during his first 2 years of life is permanent.
He has some mild motor problems in terms of when you watch him walk, it's not 100% normal, but functionally it is. That means that he can basically go do things that he wants to do on a day-to-day basis, and that's what I care about. He's able to act like a child.
I play basically every sport in our backyard that's possible, and I just love playing sports.
If Alex were to stray from the diet, the effects would be devastating.
I would think the consequences would be most likely affecting his nervous system and possibly something affecting the brain directly, which could be seizures or further brain degeneration.
But for such a deadly disorder, the Salems had to wonder why it couldn't be diagnosed earlier.
Alex initially presents with basically a peripheral nerve problem. When x-rays were done of his brain looked perfectly normal. It's only when he had that sudden deterioration and then he showed up the excess acid in the blood that was present that basically opens people's eyes to say there was something more going on than that.
Alex is pretty much writing the book as to what is potentially possible for people with this disease or on a long-term ketogenic diet.
Many times people will ask us, how do you do that? How do you have a child on this special diet? How do you manage living with this every day? Isn't that difficult to cook differently? Look at his face. As his parent, my choice is to say this is too hard or this is difficult. I would walk on hot coals. It's not hard. It's for Alex.
Doctors knew that Alex Salem was sick, even if they didn't know why.
Interesting video, huh? So moving on, who has the deficiency? Well, males often have the severe disease and have an early death than females. However, females more often develop progressive neurological symptoms than males, and there does not seem to be disproportion ethnically for this disorder. Specifically, through it is widely known that African American, Mediterranean, and African populations are more at risk for certain genetic disorders. In this slide, we see a chart. And in the chart, we are able to dissect the outcomes of 371 patients with the deficiency. And we can see that there were 294 patients in whom death or survival was documented at the time of reporting, and 77 patients were unknown at the time of reporting. Now we can see in blue the people that reported that were still alive in the cases, and then in red you can see, as the chart states, the deceased. And now we see as that most of the deaths occur at an early age, but it remains consistent throughout 20. But we see that there are less reports of people being alive as they approach the age of 20. For current research, at the University of Colorado School of Medicine, researchers have noticed that in patients with pyruvate dehydrogenase complex deficiency, basal ganglia lesions on MRI are reversible with treatment in some cases. And this could possibly be used as a biomarker for measuring responses to treatment. At Central China Normal University, researchers found that compound 5B could be taken as potential lead compound targeting PDHCE1, pyruvate dehydrogenase, to obtain environment-friendly algaecide for harmful cyanobacteria